Imagine you're just taking a simple pill for high blood pressure, but weeks later, you start noticing unexplained headaches, dizziness, or worse muscle cramps that won't go away. You never thought your medication could be the cause. What if I told you that nearly 1 in 4 people experience side effects from amlodipine, and some are so severe, your doctor might be secretly hoping you never find out? Amlodipine is one of the most commonly prescribed hypertension drugs. It's supposed to help, but what if it's causing more harm than good? Today, we're exploring the top amlodipine side effects you need to be aware of. By the end of this video, you'll know exactly what to look out for and how to avoid the surprises that could put your health at risk. Stay tuned, and let's uncover what your doctor might not be telling you. Stick around till the end, because you won't want to miss the last side effect. It's something most patients have no idea could happen. Swelling in the ankles or feet, also known as edema, is a common side effect of amlodipine. This condition occurs when fluid accumulates in the lower parts of the body, especially in the legs and feet, causing them to become puffy or swollen. It might feel like tightness or heaviness in the affected areas. According to a study, up to 10% of people on amlodipine experience some degree of swelling, often due to the medication's effect on blood vessels. The primary cause of this swelling is related to amlodipine's ability to relax and widen blood vessels. While this helps reduce high blood pressure, it can also cause fluid to pool in the lower extremities, particularly when a person stands or sits for prolonged periods. The fluid buildup is more noticeable in the feet and ankles because gravity tends to pull it downwards. For many, this side effect can make daily activities uncomfortable, such as walking or standing for long periods. Some may feel self-conscious about the visible swelling. Managing this side effect may include elevating the legs periodically, drinking plenty of water to help flush out excess fluid, and consuming natural diuretics like watermelon or cucumber. Regular movement and avoiding long periods of immobility can also help, as can wearing compression stockings to promote circulation. If the swelling persists or worsens, it's crucial to consult a healthcare provider for alternative treatments. A doctor might suggest adjusting the medication dosage or exploring other options if this side effect is affecting your quality of life. Dizziness. Dizziness or lightheadedness is a common side effect of amlodipine, often described as a feeling of unsteadiness or a sensation that you might faint. It usually occurs when standing up too quickly or moving from a seated position. You might feel like the room is spinning or as if you're about to lose balance. Around 5% of people taking amlodipine report this side effect, particularly when they first start the medication or after a dosage increase. The cause of dizziness is related to amlodipine's effect on blood vessels. By relaxing and widening the blood vessels to lower blood pressure, the medication can cause a drop in blood flow to the brain, especially when changing positions quickly. This sudden drop in blood pressure can cause temporary lightheadedness. For example, someone might stand up from a chair after sitting for a long time and suddenly feel like they're going to faint, which can disrupt their daily routine and make activities like driving or walking challenging. To manage this side effect, it's important to rise slowly and avoid sudden movements. Staying hydrated is essential, as dehydration can worsen dizziness. Adding potassium-rich foods like bananas or avocados to your diet can also help maintain balanced blood pressure. If the dizziness persists or becomes frequent, it's important to consult a doctor. A healthcare provider may recommend adjusting the dosage or considering other medications. Headaches. Headaches are a common side effect experienced by some individuals taking amlodipine. This can range from a mild tension-type headache to a more severe, throbbing pain. It often feels like a constant pressure around the head, particularly in the forehead or temples. According to studies, about 7% of people on amlodipine report headaches as a side effect, especially when starting the medication or adjusting the dose. The reason for this side effect is related to amlodipine's effect on blood vessels. As the medication works to lower blood pressure by dilating blood vessels, it can cause an imbalance in blood flow, which may trigger a headache. This effect is often temporary and may decrease as your body adjusts to the medication. For example, someone might experience a dull, persistent headache after taking amlodipine in the morning, which makes it harder to focus at work or carry out daily tasks. This can affect productivity and mood. To manage headaches, drinking plenty of water can help as dehydration can worsen the pain. Simple remedies such as using a cold compress on the forehead or practicing relaxation techniques like deep breathing can alleviate discomfort. If headaches continue or become severe, it's important to consult a healthcare provider. Your doctor may recommend a dosage adjustment or suggest alternative medications. Flushing. Flushing is a side effect that causes a sudden reddening or warming of the skin, often felt in the face, neck, or chest. This can create a sensation of heat or warmth, sometimes accompanied by sweating. It may appear suddenly and can last for a few minutes or longer. Studies show that about 10% of people taking amlodipine experience flushing, particularly when starting the medication or increasing the dosage. Flushing occurs because amlodipine relaxes and widens blood vessels, which can cause blood to flow more easily near the surface of the skin. As a result, areas like the face or chest may appear redder or feel unusually warm. This side effect is more common in individuals who are sensitive to changes in blood circulation. For example, a person might experience a sudden feeling of warmth in their face while attending a meeting or social gathering. This can be uncomfortable or even embarrassing in public settings, potentially affecting social confidence or workplace interactions. To manage flushing, it's helpful to avoid triggers such as hot drinks or spicy foods that can exacerbate the redness. Drinking cool water can also help soothe the sensation. If the flushing becomes frequent or bothersome, it's best to consult a doctor. A healthcare provider may adjust the medication dosage or offer advice on managing the side effect. Heart palpitations. Heart palpitations are a common side effect of amlodipine, and they are typically described as an irregular or rapid heartbeat. Some people experience a sensation that their heart is racing, pounding, or fluttering in their chest. This can last a few seconds or minutes, and it may feel unsettling or even frightening. Around 5% of people on amlodipine report experiencing heart palpitations, especially when starting the medication or after an increase in dosage. The cause of heart palpitations while taking amlodipine is linked to the medication's ability to relax blood vessels and lower blood pressure. As the heart works to adjust to these changes, it may beat faster or in an irregular rhythm. This can be more noticeable in people who are sensitive to blood pressure changes. For instance, someone may feel their heart suddenly racing after getting up from a chair or during physical exertion, making everyday activities uncomfortable. This side effect can affect daily life, causing anxiety or discomfort, especially if the person is concerned about the sudden change in their heartbeat. Managing heart palpitations involves avoiding excessive caffeine, staying hydrated, and practicing relaxation techniques like deep breathing. If palpitations become persistent or severe, it's crucial to consult a healthcare provider. Your doctor may consider adjusting your medication or exploring other options to ensure your heart's health is properly managed. Fatigue. Fatigue is a common side effect of amlodipine, often described as an overwhelming feeling of tiredness or lack of energy that doesn't go away with rest. This can leave a person feeling drained, even after a full night's sleep. Around 4 to 6% of individuals taking amlodipine report feeling fatigued, especially during the early stages of treatment or after a dosage increase. The cause of fatigue is related to how amlodipine works. By relaxing blood vessels and lowering blood pressure, it can lead to decreased blood flow and oxygen to various parts of the body, including the muscles. This reduced oxygen delivery can cause feelings of tiredness or weakness. Additionally, the body's adjustment to lower blood pressure can leave someone feeling sluggish or less alert. For example, a person may find themselves feeling more tired than usual at work or during daily activities, such as climbing stairs or playing with children. This fatigue can negatively impact productivity, mood, and overall quality of life. To manage fatigue, it's important to prioritize rest, stay hydrated, and eat a balanced diet with plenty of fruits and vegetables to support energy levels. Regular light exercise, like walking, can also improve circulation and help combat tiredness. Nausea. Nausea is a side effect of amlodipine that can cause an unsettled feeling in the stomach, often accompanied by the urge to vomit. It typically feels like a queasy or uneasy sensation in the abdomen, and it can range from mild to severe. Studies suggest that up to 4% of people taking amlodipine experience nausea, especially during the initial phase of treatment. This side effect occurs because amlodipine can affect the gastrointestinal system. By relaxing blood vessels and lowering blood pressure, the medication can influence the blood flow to the stomach, which may disrupt the digestive process. Additionally, amlodipine may increase stomach acidity or cause the stomach to empty more slowly, contributing to nausea. For instance, someone might feel nauseous shortly after taking amlodipine, especially if they haven't eaten enough or are on an empty stomach. This can make everyday tasks, like eating, working, or socializing, more challenging and may discourage individuals from continuing with their medication. To manage nausea, it's helpful to take amlodipine with food, as this can help reduce the stomach irritation. Drinking ginger tea or sucking on peppermint candies can also provide natural relief. Abdominal pain. Abdominal pain is a side effect that some individuals taking amlodipine may experience. It can feel like a dull ache, cramping, or bloating in the stomach area, which may vary in intensity. This discomfort can occur shortly after taking the medication or may persist throughout the day. Studies indicate that about 3 to 4% of people on amlodipine report experiencing abdominal pain as a side effect, particularly during the early stages of treatment. The cause of abdominal pain while taking amlodipine is related to its effect on blood circulation. By relaxing blood vessels to lower blood pressure, amlodipine can also affect the blood flow to the digestive system, causing discomfort. Additionally, amlodipine may delay stomach emptying or cause slight irritation in the gastrointestinal tract. For example, a person may experience mild stomach cramps or a bloated feeling after taking amlodipine, making eating or sitting comfortably difficult. This can impact daily activities and potentially lead to concerns about continuing the medication. To manage abdominal pain, it's beneficial to take amlodipine with food, as this can reduce irritation. Eating smaller, more frequent meals and avoiding spicy or fatty foods can also help alleviate discomfort. Muscle cramps. Muscle cramps are a common side effect of amlodipine, often described as sudden, sharp, or painful contractions in the muscles, typically in the legs, feet, or calves. These cramps can be intense and may last for a few seconds or up to several minutes. Research shows that around 5 to 6% of individuals taking amlodipine experience muscle cramps, particularly in the early stages of treatment or after dosage adjustments. The cause of muscle cramps while using amlodipine is linked to the medication's effect on blood circulation. By relaxing and widening blood vessels to lower blood pressure, amlodipine can sometimes reduce the flow of blood to the muscles, leading to a lack of oxygen or nutrients. This can cause muscle spasms or cramps. Additionally, electrolyte imbalances, particularly low potassium or magnesium levels, can increase the likelihood of cramps. For example, a person might wake up in the middle of the night with a painful calf cramp, making it difficult to walk or exercise the following day. This discomfort can affect daily activities, like walking or doing physical work. To manage muscle cramps, staying hydrated is essential, as dehydration can trigger cramping. Eating potassium-rich foods like bananas or leafy greens can also help prevent cramps. Skin rash. Skin rash is a common side effect of amlodipine, often presenting as redness, bumps, or itching on the skin. It can appear anywhere on the body and may vary in severity, from a mild irritation to a more widespread rash. Studies show that around 2 to 3% of individuals taking amlodipine experience skin rashes, particularly during the initial stages of treatment. The cause of the rash is related to amlodipine's effect on blood vessels. As the medication dilates blood vessels to lower blood pressure, it can sometimes trigger an allergic reaction in the skin, leading to a rash. This reaction occurs as the immune system responds to the drug, and it may be more likely in individuals who have a sensitivity to the medication. For example, a person might notice a red, itchy rash appearing on their arms or chest after taking amlodipine, making them uncomfortable or self-conscious in public. This side effect can lead to anxiety about continuing the medication, and disruption to daily life. To manage a skin rash, it's helpful to apply a cool compress to the affected areas to relieve itching. Over-the-counter antihistamines or hydrocortisone cream may also provide relief. If the rash persists or worsens, it's essential to consult a healthcare provider. Increased heart rate, also known as tachycardia, is a side effect that some people experience while taking amlodipine. This condition is characterized by a heart rate that is faster than normal, typically above 100 beats per minute when at rest. It can feel like a pounding or racing heartbeat, which may be noticeable in the chest or neck. Research indicates that about 2 to 4% of individuals on amlodipine experience an increased heart rate, especially during the early stages of treatment. The cause of this side effect is related to how amlodipine works to lower blood pressure. By relaxing and widening blood vessels, amlodipine can cause a reflex response where the heart beats faster to compensate for the lower blood pressure. This mechanism is the body's natural attempt to maintain adequate blood flow and circulation. For example, a person might notice their heart racing after physical activity or even during moments of rest, which can be uncomfortable or alarming. This increased heart rate can make daily activities like exercising, relaxing, or even sleeping more difficult. To manage an increased heart rate, it's essential to avoid stimulants like caffeine and stress, which can exacerbate the condition. Staying hydrated and eating magnesium-rich foods, like spinach or almonds, may help regulate heart function. Low blood pressure, or hypotension, is a side effect of amlodipine that occurs when blood pressure drops too much, leading to dizziness, lightheadedness, or even fainting. This condition is often characterized by symptoms like weakness, blurred vision, or feeling faint when standing up. Research indicates that approximately 5 to 7% of individuals on amlodipine experience a drop in blood pressure, particularly when they first start the medication or after dosage adjustments. The cause of hypotension is related to how amlodipine works. The medication relaxes and widens blood vessels to lower blood pressure. While this is beneficial for individuals with hypertension, it can sometimes lower blood pressure too much, causing the symptoms of hypotension. The body may struggle to maintain normal blood flow, especially when transitioning from sitting or lying down to standing. For instance, a person may feel faint or dizzy when standing up quickly, which can make daily tasks, such as getting out of bed in the morning or standing in line, difficult and dangerous. To manage hypotension, it's important to rise slowly from sitting or lying positions to allow the body to adjust. Staying hydrated by drinking plenty of water and eating small, frequent meals can help prevent blood pressure from dropping too low.